Wango Galiaga calls himself a storyteller. He goes around the country to share his experiences. Wango is HIV positive, but he said that the courage to tell his story didn't come easy.
It wasn't in my frame of reference. I didn't know anybody who had it. I didn't know anybody who talked about it. It was just something that you heard all the time. People dying of it.
Getting over that shock, he has now come out publicly about his illness and has been trying to raise awareness about the HIV/AIDS situation across the country. And his advocacy comes at a precarious time. New HIV/AIDS cases have increased 5 times since 2007, with around 300 new cases every month. The Philippines is one of only 7 countries worldwide where HIV infection rates continue to rise rapidly.
The improvement of health
Discrimination and lack of awareness is rife. The government has yet to vote on the much-contested reproductive health bill that aims to institutionalize safe-sex education. The international organization, the Global Fund, has been financing more than 60% of HIV/AIDS treatments in government hospitals such as this. But with that funding set to end by September, it is now unclear how the government will be able to provide those services. Public spending on HIV prevention and treatment has dwindled. The health department reportedly has a budget shortfall of almost $400 million for the next 5 years. And with a third of its 92 million people earning less than $2 a day, health experts have warned an AIDS crisis is looming.
There's still a lot of stigma going on for those key population groups. And because of that, most of those will not come for voluntary counseling and testing. And because of that, we will probably not know the exact situations of HIV/AIDS. What we see as new cases are still tip of the iceberg.
Wango hopes that people will learn the lessons of his past, but more so that the government will finally act before it's too late. Jamela Alindogan, Al Jazeera, Manila.